Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode 227 of the Better Health Guy blogcast series. Today's guest is Dr. Simon Yu, and the topic of the show is It Ain't No Accidental Cure. Dr. Simon Yu combines internal medicine with integrative medicine at Prevention and Healing in St. Louis, Missouri. As an HMO regional medical director, he saw the limits of a medication management approach to patients with complex chronic illness. He studied integrative and biological medicine, took 300 hours of medical acupuncture training, and researched dental, fungal, and parasite problems. He served as a medical officer in the United States Army Reserve for 25 years, retiring as a full colonel. Dr. Yu lectures in the U.S. and abroad. He offers Acupuncture Meridian Assessment training in St. Louis and in Germany to help detect problems for doctors and dentists. He has an MD from the University of Missouri School of Medicine, has an MS in Immunology, is certified by the American Board of Internal Medicine, a member of the American College of Physicians, and is on the advisory board of the International College of Integrative Medicine. And now my interview with Dr. Simon Yu. Dr. Simon Yu was on the podcast in episode 103, where we talked about his second book, Accidental Blow-Up in Medicine. Today, I'm excited to have him back to talk about his latest book, Accidental Cure 3, AI versus Ancient Intelligence. We'll learn that when people improve their health with his approach, it's very possible that it ain't no accidental cure. Dr. Yu's been one of my mentors and heroes in my own health journey, and I'm really looking forward today to learning some new things from him. Thank you so much for being here, Dr. Yu.
Thank you for the invitation, Scott.
Your system of evaluation is called Acupuncture Meridian Assessment, or AMA. Some may be familiar with the concept of electrodermal screening, electroacupuncture according to Vol, or EAV. You look at 40 or more different meridians to identify dysregulation or disturbances, and then looking at what that tells you, what story unfolds about the person sitting in front of you, including potential treatment interventions to balance the meridian system, to negate or address the stressors that are creating that dysregulation in the first place. You say that you view the body as a musical instrument, much like playing, tuning, practicing, learning, and further practicing the violin. I know you say your approach is teachable, and I know many people have learned a lot from you about how to do this, but I would say that like a great violin player, I personally think that you have some unique gifts that go beyond what others might easily be able to learn. Talk to us a little bit about how you started down the path of creating Acupuncture Meridian Assessment in military hospitals with sick soldiers. What led you to even come up with the concept of energetically evaluating those soldiers? What did you think you might find? Did you have any idea at the time? And what did you find in terms of patterns now 25 years ago?
So for me, I describe AMA is actually from German electroacupuncture, classical acupuncture called EAB, electroacupuncture according to Dr. Vol. But I learned this from dentists. So I'm very tuned into dental aspects of it. And it's not easy to learn. It took me many, many years, and I was about to give up on a classical EAB. They use a lot of homeopathic principles, and it takes too much time. And I felt like I lost track of what to do with my patients. Too many information. I didn't know what to do with this. So about 25 years ago, I was in Bolivia as part of my military mission. We are required to use parasite medication for our native Indians. We use mebendazole and parental palm oil. Now, mebendazole will be equivalent, but bendazole, people are familiar with it. So that was 2001. I used parasite medication. People describing immediately next to the passing parasite, they bring the parasite. We went through this for 10,000 people in 2 weeks period. That's when I used first time using parasite medication, because before that, I never really used parasite medication. Even if you look for parasite, nothing shows. I never thought we have a parasite problem. But I did follow Hulda Clark's natural parasite remedies that has a wormwood, black walnut, and clove oil with moderate success. So when I came back in 2001, I decided maybe I'll use some of those parasite medications I used in Bolivia. This is where the major change. I was about to give up the EAV, but I was already using it. So when I started using parasite medication, not natural parasite remedies, but actual prescribed parasite medication, that's what I was experiencing, quantum jump in people's response. Not only typical IBS, diarrhea, constipation, irritable bowel syndrome improved, people are start saying their asthma went away. That's the first thing I noticed. Asthma and bronchial symptoms, nocturnal cough. And then I hear this chronic fatigue, fibromyalgia patient improved. There's no cure for that at that time. And my MS patients say their brain lesion disappears when they're on parasite medication. They get a phone call from a neurologist say, you don't have a MS anymore. I couldn't figure out what that meant earlier. So I started writing this phenomenon as an accidental cure. And I started using this when I was on active duty. I go to intensive care unit. By the time I was there, I was a lieutenant colonel and full colonel, and they don't bother you. When you hit the rank colonel, they don't challenge you. So I was able to change the different medication based on Meridian tests. And people keep pointing out, whatever I'm doing is not classical EAV. You're doing something different. So I thought about it. I said, I'm going to describe exactly what I do. Acupuncture Meridian Assessment, for me as an internist, is my interpretation. So I call it AMA. Part of it is a joke, actually. Acupuncture Meridian Assessment, AMA, how the study goes. So that's how I started. And so I started with a parasite medication first time in military and active duty for U.S. Army mission.
We hear so much these days about AI or artificial intelligence. Where do you think AI will take the future of medicine? And talk to us about how you compare artificial intelligence with acupuncture intelligence and which AI has the greater potential for healing.
We probably have to combine AI with ancient intelligence, what called acupuncture intelligence. We have to combine them. I'm not computer savvy. I'm always dread using computer system, the ChatGPT. I have to ask other people to help me. They give you pre-existing data, the database. So let's say you're interested in MS patient. If you look at the asking question, is MS associated with an infection? The ChatGPT will tell you, yes, there is an infection associated with MS, but they'll give you a whole list, virus, bacterial, fungal, parasite, all this. What do you do with that, all the information? You still have to individualize a case study. So we need to combine that, I think, AI, but for individualized care, we still need that, what I call ancient intelligence based on acupuncture meridian system.
So maybe we'll have an AI squared at some point in the future. With your AMA technique, talk to us a little about the more common patterns of meridian dysregulation that you observe in your testing with people with chronic health challenges. You've already mentioned parasites, but what are some of the meridians that you most commonly see? And then what are some of the common dysregulators or root causes of that meridian dysregulation?
So one of my first indications, I noticed a large intestinal meridian. that makes sense. Large intestine, I was thinking about parasite. Rather than using Hulda Clark's formulation, wormwood, black walnut, and clove oil, I decided to use parental palmate or mebendazole. This I was using when I was in active duty. So that's the first step. And then small intestinal meridian, gallbladder meridian, liver meridian, spleen meridian, pancreas meridian. And once you go through this whole process, wait a minute, so many problem goes away, except dental problem, except allergy, immune system. That's what I see, autoimmune problem, or like a fungal problem, environmental toxin, glyphosate, all those things associated will pick up through the allergy, immune system. Autoimmune disease has been an epidemic problem because we're not getting into the root of the problem.
In your AMA system, you have various provocation techniques. So this is a scenario where you test someone and they appear to be pretty balanced, maybe because they've been treated, maybe because their system is just not revealing those dysregulations. So then you move into what you call Operation Open Sesame or advanced interrogation techniques. You also have enhanced interrogation techniques as well. You may be using various light, needles. Some places you have people actually hold a religious book. And so I'm wondering, how does someone holding a religious book bring more things to the surface? Is it aligning that person more with a source of higher truth? Is it putting the fear of God into that person, which then stresses or provokes the nervous system to reveal new things that were previously hidden? Or could it be either, depending on that person's relationship with the divine?
Basically based on frequency and phase contrast. I'm looking at not necessarily in religious context, but Bible itself have its own frequency, but whether you call it higher level of frequency, and that create a certain resonance, or this resonance creating a contrast. I'm looking for the contrast to change, give a hidden problem. I never used the Bible until when I wrote an article about this article is called Mary from Argentina. Is a lady with a colorectal cancer, metastasis to the lung, and she had this intractable cough. At the same time, I have a patient from Arizona but he's big into Bible, and I didn't know what to do with her. I asked him, you've been talking about the Bible, can you pray on this patient and see what happened? And I was busy seeing another patient, and I got a knock on the door. He was going through the typical what we call Bible prayer, somewhat like an exorcism, and they brought the huge hunk of a mess she coughed out. And I said, that's interesting. I'll get back to you. I finished my patient and went back. Where is the mess come out? Let's send it to the lab. And they said they throw it away. So my patient is actually praying for another patient from Argentina and coughing a mess. I said, I think there's something to the Bible. At that point, I say, whenever I don't know what to do with my patient, I say, if it's don't mind, I'll use Bible for you to hold on to. And I start measuring. Those of you already went through parasite cleansing, dental, and multiple cleansing, and nothing shows. And sometimes you see so clearly, but the pattern is usually parasite embedded in the large intestinal meridian, small intestinal meridian, or through the gallbladder liver meridian. And they all almost always seems associated with a parasite. So I'm trying to connect the connection with the parasite with maybe almost like a demonic in characteristic as like a negative frequency, but not in religious context. Yeah.
Let's get into parasites a bit. So where do we think most people are acquiring parasites? What is it that you think is opening the door to the persistence of these chronic infections within us? Is it the toxic terrain, the environment that then is inviting these organisms to live in us? when you're treating parasites, do we ever fully eradicate them, or is the goal to reduce the burden to the point that the immune system can contain them throughout our lifetime? And if you see somebody that's doing parasite treatment, but they don't seem to be responding, do you then consider other potential sources of re-exposure, or what some might call recidivism, meaning family members, pets, maybe foods that they're eating, maybe their own dental issues that are seeding the rest of the body with parasites?
First of all, I think from our own ignorance, over 100 years ago, they knew the importance of the parasite. As a practitioner, practice usually purging, like either castor oil or natural herbs, go through the preventive cleansing springtime, maybe for. We have this idea of the modernization, with the hygiene, we don't have to worry about parasite problems. So that's the first step. If you look at the record 100 years ago or more, the immigrants coming into the United States have to be in a quarantine state, and they usually go through the what called deworming process. So we lost that part of it. We also have now animals living in our household that can be a vector to bring the parasite. So there's a multi-source of infection. And technically, parasite can pass on from the mother to the child as a transgenerational. It can be like a toxoplasmosis. And look at from scenario when the child is able to crawl, they're on the floor. The first thing they do is touch their hand to the mouth. When they're 1 year, 2 years old, if you have animals and whatever, they were very susceptible to have a parasite exposure at a very young age. And then there's a change in climate, So while we don't see the parasite in northern Wisconsin, now we have a parasite problem will be documented by parasitologists, like a schistosome. You expect to see in Indochina, Egypt, is now in Northern Lake in Wisconsin. That was reported by parasitologists. At the same time, we assuming we don't have parasite problem. That's a terrible error in our part. And the test is not reliable. And most parasites are not in GI tract. It can be in your eye, it can be in your brain, it can be in your kidney, in pancreas. And they look for the stool test, but it's just we're going nowhere with that whole concept. We can coexist with parasite, coexist with your terrain, because terrain is always important. So one of the Indian doctors always telling me, if you're Indian without parasite, are not true Indian. But Indian food are designed to coexist with parasite. So you may have a parasite, but the hot, spicy, tomato, garlic, and whatever the hot spice, they make them to coexist with parasite. So they can still function as a normal lifespan. Well, those Indians who are moving to the United States, that is eating more American food, they start having a problem because they have a parasite problem, but now they have it gets out of control. So that's part of that concept of the terrain. And we can share the parasite with whether you have family members and they have animals. So yeah, it can be, but it's not as infectious as like a viral infection, but yes, it can. So that's the dilemma where I see family comes, sometimes I have 4 children who are very sick, and I usually pick and choose one of the sickest children. I'll treat them, and you can treat for the rest of the kids to treat the whole family.
Would you say that all parasites are bad, or can they sometimes be beneficial if they're, for example, protecting us from a toxic terrain that's burdened with heavy metals? Do we find that the more toxic someone's terrain is, the more likely they are to have more parasites, more fungal organisms? Or could some parasites actually favorably modulate our immune system? We see more and more in conditions like PANS and PANDAS and maybe autism, where people are using parasites like HDCs therapeutically to address the autoimmune immune modulation component of that child's issue. And so I'm wondering, is it reasonable to say that if someone had parasites, but they were overall favorable for that person, and you were evaluating them with AMA, that they would not show any associated meridian dysregulation? Or do you think that all parasites should be addressed?
First of all, I like to look at it from evolution point of view. We are evolving with parasite. Parasites evolving at a faster adaptation than we can adapt to it. So in modern world with environmental toxins and parasite will be adapted to the environment and we have a hard time keeping up with it. So what you said is correct both ways because parasite may be adapting and taking in this like environmental toxins, heavy metals. And when you go after the parasite, we see more pickup, more actually environmental toxin will be releasing it. So you have to do it at the same time. It's not separate, phenomenon. And if you look at like a Dr. Weinstock using parasite medication to reduce autoimmune response like a Crohn's and irritable bowel syndrome. So people use what called non-pathogenic parasite for human to introduce the modified ecosystem of the gut microbiome, and those non-pathogenic parasites will eventually die up. At least that's the theory behind it, with some moderate success for irritable bowel syndrome and like a Crohn's disease. So yes, parasite can be used, but by definition, parasite is an uninvited guest that taking the energy away from you. But we can use non-pathogenic parasite that's not affecting human to use it to introduce enemy with another enemy of the parasite.
And I'm assuming then in your AMA testing system, we would only see meridian dysregulation if that parasite was pathogenic.
Well, at least that's the whole idea, but I can never be for sure. The real test is when patient is getting better or not.
One recent interesting point that I was listening to a parasite expert practitioner, they were talking about how parasites generally do not have a full replication cycle in the human host. They were suggesting that the parasite eggs in the body cannot become new parasites unless they leave the body, go into the soil, and then kind of complete the life cycle. So I'm wondering, do parasites replicate in the body? And is it certain parasites that can complete their life cycle in us, and maybe other parasites that then have to leave the body and mature in the soil to then infect someone else?
This is where typical medical textbook describe a parasite will go outside and go through a different life cycle. That's our understanding of the parasite. But because of the change in environment, the ecosystem, our body is changing with all the toxin and environmental toxins. I think this is a real phenomenon. We see the recycling within our human body. That's what I think is going on. Whatever is going on in medical textbook doesn't always correlate with what's going on with our human ecosystem.
In the early days, you mentioned that you started treating parasites with pyrantyl palmate and mebendazole. Over time, it seems like it's taking more medications to fully address the parasite issues that people are dealing with. With the tools that we have today, are we staying ahead of the curve, or are you beginning to see parasite-related issues in some people where it's becoming more and more difficult to balance those meridians, to address those parasites that are causing dysregulation? Is there potentially a time when humans lose to the parasites, or is that not likely because they need us to be alive for them to be alive?
Yeah, I'd like to look at it from evolution. As I say, I think parasite is evolving, and we are evolving to adapt with how parasite is changing. And so we have to constantly change. Meanwhile, we have to change our terrain because we've been exposed to so many environmental toxins, EMF, petrochemicals, and also emotional, psychological aspects of the narrative frequency. And one of the consistent, my understanding from my observation has been dental. If you have a dental infections, I feel almost impossible to break that cycle. You have to take care of the dental as a part of it, because dental is not just a dental. I'm talking about dental parasite and dental endotoxin. These create for how to break the cycle for whole cycle of the evolution of the parasite that we have to adapt to it.
Fenbendazole is another antiparasitic, not approved in the US, but I'm sure you've worked with people that have used it on their own. I'm wondering if you find that it works better than other medications like nitazoxanide, pyrantyl palmitoate, praziquantel, ivermectin, albendazole, mebendazole. Or is it just another tool in the toolbox? What combinations of antiparasitics are you most commonly finding effective today?
Okay, I don't use fenbendazole. It's considered animal grade, and I don't want to get myself in trouble. Equivalent will be albendazole and mebendazole, except albendazole have some side effect with the hair loss. So usually I use mebendazole. It doesn't happen that often, but sometimes when you have a hair loss, especially young women, they really get upset. So albendazole will be my second choice. I use mebendazole. But there's no one is better than others. It's which combination give the best response. So I'm not as much concerned about is mebendazole better than anything else. So you go through the process. And my experience has been first three combination works the best with minimum side effects. That's ivermectin, parental palmitoate, and praziquantel. They cover for major large parasite, either nematode, ascaris, pinworm, strongyloid, tapeworm, flukes. And I always add that wormwood complex that has a wormwood, black walnut, and clover as a combination. And I usually throw in antifungal nystatin with it. That's the first layer to get the big one. And then you go through the 2-3 cycle, then another community of the parasite will rise. There's a more microscopic parasite. That's when I use tanadazole, metronidazole, or alenium. And then when you go through the process, another layer of the deep fungal infection show. That's when I use itraconazole or fluconazole. And you have to go through the cycle. And then there's a dental infection. You have to go through antibiotics and some other anti-protozoal parasite medication. There's a process you have to go through it.
Toxoplasma, which you mentioned earlier, is a fairly common protozoal parasite that can impact the brain, can impact mental, emotional health. If someone has toxoplasmosis, largely impacting their brain, would that show up in AMA with a specific meridian? Are you using tools then like pyrimethamine or daraprim? What's working for toxoplasma? And given that it also is likely never fully eradicated, do those patients tend to need more ongoing treatment? And then lastly, building on that, which of the pharmaceutical antiparasitics that you mentioned actually can cross into the blood-brain barrier?
When you have an infection and disruption in blood-brain barrier, then most of those medications will also cross blood-brain barrier. So if the parasite, the large parasite go through the blood-brain barrier, there's a disruption. And medication that normally will not cross the blood-brain barrier will cross the blood-brain barrier. For toxoplasmosis, whatever my limited experience, most people never have a toxoplasmosis alone. They have multiple different parasite medications. So you always go for big one first. Ivermectin, parental palmitoate, praziquantel, they have some improvement. And then you go through the layer, and eventually I will test it out with the toxoplasmosis. Now we're going after the single unicellular protozoal infections. And I'll check for blood tests. Some of them have very high titers, and it doesn't seem to have a major impact on them, but many people doesn't have it and have a very strong reaction to parasite medication. The one I use is a pyrimethamine, clindamycin, and sometimes I have to add alenia with them. That 2 or 3 different combinations give the best response. typically 30 days, but some people require 60 to 90 days. But that will be later on, not start with the toxoplasmosis. You have to go after the bigger parasite medication first.
More than 15 years ago, I first heard the term ropeworm. It's still a very popular discussion. With your approach to treating parasites, do you see patients having ropeworms leaving their body? Have you come to the conclusion that a ropeworm is in fact a parasite, or is it a biofilm community of many different organisms? What are your latest thoughts on ropeworms?
People describe their passing ropeworm, and I'm not sure it's a true identifiable parasite. I'm thinking more like there's a community of a parasite that excreting the mucous biofilm that looks like a ropeworm. And it can go on for many months or even years. And one of my patients said he feel like there's a octopus attached to his gut and keep releasing this ropeworm. We have to go through years, several years, go through the process so it's under control. So it can go on for several years about, ongoing different combination of the parasite medication. That's why it's important for like a triple parasite medication and then use for protozoal infection, fungal medication, intracellular parasite, and go through the cycling while you're using a lot of enzyme to break the mucus. Enzymes and iodine, there are many different herbs people use. I'm not an expert in herbs, but people use different combinations. I just use a lot of enzymes.
Do you find that people that have ongoing environmental exposures to mold and mycotoxins have a more difficult time addressing the parasites? How important is it to address that external environment to then have a more successful foundation for working on the internal environment in terms of chronic infections?
Fungal infection and mycotoxin become its own sort of a separate entity, and yes, it's interconnected. So it's easier for me to just like one single case. If a patient comes from Colorado, she's a librarian, cannot live in her home, more sensitivity, go to friend's house, and then after a while they get sensitive to every house, the more, become literally homeless. And she drove down to see me, and when I checked, she have a major dental problem, have to be removed right away within 3 days. Go through the parasite cleansing, multiple parasite cleansing with antifungal medication. And then she told me she came back 1 year later. She can tolerate more that she couldn't tolerate before. So now she'll be able to settle in one of her permanent place. I'm not focusing on a mold itself, a mold sensitivity. Sometimes people have a fixation with this mold and they cannot go forward. They're so sensitive to everything, they cannot tolerate. And I say, you have to go through parasite cleansing. You have to put the tools. Now you will be able to handle what I couldn't tolerate before. But there's that transition time. Some people are willing to go through that. Some people say they just cannot handle it.
You say in the book that homeopathy is for the divine, herbs for the human, and drugs for the demonic. I personally have generally really been drawn to herbs and homeopathy, but some of my favorite pharmaceutical drugs are the antiparasitics. You mentioned that you do combine some herbs with the pharmaceuticals like the wormwood complex. Do you use any homeopathy in addressing some of these parasite issues? Why is it that you feel the drugs are necessary? And would you potentially start with someone using the pharmaceutical medications, but maybe longer term doing things to create a terrain that is more hostile, like herbs or spices? And how often should we consider kind of a regular parasite cleansing just from a preventative perspective?
I used to use homeopathic remedies for children for parasite with a moderate success, natural parasite remedies. But when I start using the real prescribed medication, there's really a quantum jump in response. So after a while, it's like why even bother to use homeopathic remedies? Most people tolerate parasite medication. If you give right killing dose, there's hardly any side effects. The biggest problem with the prescribed parasite medication, underdosing. And then parasite will start moving around to go to the deeper level, to the lung, to the liver and pancreas, and then that creates even bigger problems. So I tell my patient, a lot of my patients doesn't want to use any prescribed medication. And I say, I'm using poison to not to poison you, but to poison the parasite. And we have to tolerate while you're going through that process. If I target the right killing dose, you're going to have a minimum discomfort, but will get rid of the parasite. And you have to kind of mentally prepare my patient for people who have a phobia about using prescribed medication, that we are underutilizing parasite medication, but overutilizing antibiotics. But if you don't know, we give antibiotics, but often it's a parasite is a problem. I like to tell this story. One of my patients from Iowa, I gave her Ivermectin, parenteral palmoid, praziquantel, and she's looking at the medication. Wait a minute, this is what I give for my horse. So we had a nice discussion. In terms of the breeding horse, they regularly deworm twice a year. For the racing horse, she told me they deworm 4 times a year. So I tell my patient, would you like to be treated as a regular horse or as a racing horse? And they give you like a 1 week of a cycle of at least 3 different parasite medication and as a part of the deworming. The interesting part is the lifespan of horse used to be about 20 plus years. But now with the regular deworming and the dental care, improving nutrition, now the horses can live easily 40 plus years, almost doubling their lifespan. I tried to talk about the anti-aging group in Las Vegas, and they're not too excited about it, using parasite medication for the horse to expand their lifespan by doubling their lifespan. So my idea didn't go too far.
It sounds good to me. I mean, I think it's amazing. You say in the book, what if I propose that parasites are akin to demons? Parasites are deceptive, malevolent, elusive entities. They drain your energy, hijack your mind, and overpower your will. If we replace the term parasites with demons, we can then view the history of mankind and medicine from a unique perspective. So question is, are all parasites that impact our health physical parasites? Is there such a thing as energetic parasites or maybe social parasites? And what tools should we consider for mitigating those parasites that may not be in physical form, but may still have an impact on our health?
So it's actually a very deep questions. I have to be careful what I say, but at an emotional level, it will be like this. When you go through the parasite cleansing, sometimes people say, my child become more pleasant to deal with. His behavior become more improved. My husband I can easier to get along with my husband or my wife. That's certain emotional level. They're on psychiatric medication, and now with the parasite medication, they don't need as much, or they don't need those psychiatric medication when you're on anti-parasitic medication. That's one level. And then there's a social interaction where some of my patients will say, she have ovarian cancer, and then I go to the parasite cleansing and talking about parasitic relationship. Parasite relationship can be your husband or your wife, or you can be whoever. And her response, immediate response was, my boyfriend is a parasite, but I cannot get rid of him. And she come immediately, but she's also dependent on her boyfriend to support her, and she cannot break that cycle. And so that kind of a social interaction, they coexist in codependence as a parasitic relationship. And then we can talk about political parasitic relationship or financial, pharmaceutical company. I've been writing about this parasite medication for 25 years. And one thing I noticed that they've been jacking up the price outrageously. Some of them, like albendazole, I got this panic call from my patient. It will cost them $7,000. It used to cost only a few $100s 20 years ago. Now it says they cost $5,000, $7,000 or even more. So the financial parasitic relationship, these are all part of that are social parasite, or called social elite. We talk about elite taking general population, suck their energy out, but the financial, extraction from general population. But there's a little bit different aspect. So I have to be aware of that. When you get into the parasite, we have to bring it up that now on a physical level, emotional level, social level, political, and also whole spectrum, including divine, good and evil, etc.
So I want to start talking a little bit about the fungal aspect of your work. I believe the parasite focus has been around longer than the fungal focus that you now identify with the allergy immunology point in AMA. Also used to explore things like environmental allergens, heavy metals, chemicals, EMFs. There was probably a time when I thought that addressing parasites was more difficult than the fungal colonization or fungal overgrowth, but I think over time my mind has concluded that both of them are difficult. So I'm wondering, of the parasites and fungi, which one do you find is more difficult to treat? Which one takes longer? It sounds like much of the time you're kind of simultaneously working on both of these in parallel, and wondering if the reason for that is that if we push back the parasite burden, that essentially creates some real estate in our ecosystem that then without the antifungals, those fungal organisms potentially come in and further proliferate.
Well, that's theory. Yeah, that's what we think is going on. We're not really sure, but my observation has been we have to get rid of the big parasite first. What we're doing, I usually put niacin to cover for some basic fungal problem at a superficial level, so there's no overgrowth. And then eventually I have to use like itraconazole and fluconazole at a deeper level of the fungal infection and for mycotoxins. So it depends on individual. Some of them I emphasize more on parasites, some of them I emphasize more on fungal aspects of it. Or usually you have to combine them and rotate through it. A lot of our cancer patients I see have to go through the combination of the process.
So when the allergy immunology point is suggesting a potential fungal issue, how do you determine if that's current exposure in the environment affecting the person, if it's a mycotoxin burden where they really need to focus more on detoxification, or if they're truly colonized internally where the person potentially has become the moldy building. So maybe they move from a moldy environment, they're now in a clean environment, but they may still have that colonized fungus within them that's creating mycotoxins. Are you having patients do an ERMI to look at their environment? Are you using urine mycotoxin testing? And you do say in the book, which was a new learning for me, you say in the book that mold in the environment should be addressed before doing dental surgery. So I'm interested in why that has become important.
The mycotoxins suppress your immune system. They're immunotoxic. And when you're immunosuppressed and you do dental operation, they don't heal as well as they should. So I usually go through the cleansing, parasite fungal cleansing first until it keeps showing dental problem, and then I send to dentist. That's my general rule. And ERMI test, I recommend people can check for the environmental home. But you cannot tell by looking at the mycotoxin whether it's coming from internal colonized or from external. I asked at the International Fungal Conference, can you tell by looking at the mycotoxin, is it coming from the environment outside or from internal? And nobody can really tell. But so some way we have to treat this fungal infection. And it's not just a fungal infection. Some people are more sensitivity, which is another different characteristic. They are incredibly sensitive, slight, minute, moldy environment. They can sense it and they cannot tolerate it. And you cannot treat those people with an antifungal medication first. You have to look at other underlying problems. That's what you go through: parasite cleansing, dental work, and then you go through the fungal cleansing, and they can tolerate the outside environment. They become more sensitive. They can tolerate it.
And do you think that those sensitive patients, do you think that that is overlapping into the realm that Neil Nathan talks about, where their limbic system has become so hypervigilant that they're perceiving a tiger when in fact there is no tiger present? Is there a role for some of that limbic vagal nervous system work to support your treatment protocols?
It may play the role. I cannot speak for that part of the limbic system, but inhalation of the mycotoxin will go right into the brain and will go to limbic system and may develop, hypersensitivity. So you still have to go to those basically same treatment. And some people use a desensitization. That's not my expertise. I rely on other practitioners to go through the desensitization. And there are many protocols out there, but that's not part of my expertise.
You've talked about nystatin, fluconazole, itraconazole for fungal issues. Wondering if you ever use amphotericin B or voriconazole. Do you find that there's also a need to address the colonization in the sinuses at the same time as working on the gut and more systemic interventions? And how often do you find that to fully complete the treatment, we have to address biofilms?
Yeah, I don't have enough experience with amphotericin. Sometimes people use amphotericin B as a nasal spray. I will continue to refill because they claim it does help them. Voriconazole, I'm not sure they have any special more advantage over combination of the itraconazole and fluconazole, but I'm always willing to try. When therapy fails, I'm always trying to use different combination. But no, I use different combinations, but that works very well with nystatin, itraconazole, and fluconazole for most common fungal infection. One of the best way to go after biofilm is actually probably fasting. After fasting will be even alinea is known to be good for biofilm, and also a lot of enzyme that has I use called cardiozyme is a name, but it's got a whole bunch of the 10 different enzymes from bromelain, nattokinase, all those enzyme, massive amounts of enzyme, iodine. But I think there are many different herbs claiming good for biofilm, but those are some of the basic enzymes. Some of them I use actually alinea is good for biofilm. Antiparasitic is good for biofilm anyway, And gallbladder liver flush, another favorite one. They give you a lot of mucus out of your system.
I think you also use EDTA for heavy metals, which also has an effect on biofilms as well. So several aspects of your approach that are working with that. One of the things, as we start talking about the dental issues, one of the things that I really value about AMA is that it can provide us with insights about whether or not a perceived issue is in fact negatively impacting the body. So we could find a biological dentist that is really good at looking at CBCTs, that could find cavitations in a significant percentage of the population, well and unwell, which I didn't understand until talking with Dr. Stuart Nunley, who said even the general public oftentimes will have cavitations. That doesn't necessarily mean that it's a priority for the body. So what I love about your system is we can have a dialogue, we can have a conversation with the body to see if that issue that might be identified is something that needs to be addressed. And in my work with you, it was actually kind of the opposite. You found issues with AMA that the biological dentist could not confirm. And in fact, it did turn out to be a significant cavitation. So I love that you have ways to find out how stressful is something that we might know exists really on the body and what are the negative implications on our health. So we might have that CBCT that shows something or may not show something, but that still may not correlate with having or not having a potential dental issue. So if anyone's listening and you're thinking about dental issues, parasites, the things we're talking about, and you can get to St. Louis, the work that Dr. Yu does in this realm is really profound, and I highly encourage it. In fact, anytime I suggest someone goes to see him, the feedback is always incredible, and I always feel very good about where that person is heading with their health. You say that when medical treatment fails, think dental. You say the mouth is the portal to health or to hell, and that many people live longer, one less tooth at a time. You say that dental infections are the number one cause of heart problems. Amalgams, root canals, and cavitations can all negatively impact our health. How often is what you observe with our dentition, with our oral health, more related to infection versus the occlusion or the bite or TMJ, or maybe even airway issues when we start thinking about sleep apnea and those types of potential contributors to health?
So, well, all of the above effects. So, I mean, infection may play a role, but think about if you have a parasite problem, one of our response is clenching our jaw. So what we think is a TMJ doesn't go away until you go through the parasite cleansing. At the same time, you have a dental infection, and those all have to be addressed in sequence. Children will have a parasite and have an allergy problem, congestion, breathing through their mouth, and then they do have a jaw deformations, or misalignment. So have a sleep apnea. So they all play the role. So start from as a child growing up. So we have to go through the southern sequence. So sometime I will go through, a patient comes in with suspect they have a parasite problem, and then I will say, your dental is your priority problem. And they will say, well, can you treat me for parasite? So I said, that's not your priority. Then they get upset. Why don't you treat me anyway? I said, well, I don't know which one to treat because your body is telling me it's a dental problem. Well, on the other hand, sometimes I'll go through parasite cleansing and then pick up dental problem later on. And people say, why didn't you tell me I have a dental problem before? I say, I don't know. Your body is telling me parasite was the first problem. Now your body says, I'm ready to deal with the dental problem. So you have to be in right sequence, saying it's not a perfect system. It's better than no system at all. But I like to point out that cone beam CT scan is a double-edged tool. Sometimes they pick up way too many cavitation and unnecessary dental operation. If you have any 5% defect in the bone and bone marrow, CT cone beam will pick up that as a possible potential problem, and they assume because there's a hollow space, there's an infection there, but it's not really true. But you may not have any obvious defect in your bone, but pathologically, you may have a low-grade infection, endotoxin, biotoxin that become energetically affecting the rest of your body. That may have to come out. And we're getting into the subtle energy field based on meridian tests.
It is known that each tooth is associated with specific meridians and specific organs, specific functions within the body. How often do you see that play out clinically, meaning that a problem in the body distant from the tooth resolves when the issue with the tooth has been addressed, and then building on that organ, meridian, tooth system that we know of, how do the emotions overlap with those associations? Like we think of anger impacting the liver and fear impacting the kidneys. Do they affect the tooth, meridian, organs, or are the emotions not tied to the teeth and the meridians, but more directly affecting the organ systems?
Yeah, I think you can go both ways, but let's say let's say example, young boy is in my book talking about young boy fell, hit his face, and the next thing you know, he's got kidney failure. And there's already saw pediatric dentist and pediatrician, X-ray, nothing shows. He's got classic what we call nephrotic syndrome, spilling proteins and bloating. And when I check, dental is the only one showing up, but dental X is perfectly normal. And I tell the parents pull 4 teeth that's involved with the frontal tooth that's associated with a kidney. But the grown-up will be a prostate, actually. And then when you pull the tooth, perfectly normal looking tooth, and all his kidney problem, nephrotic syndrome goes away. For the grown-up will be a prostate cancer or maybe ovarian, adrenal problem. So that's kind of a relationship with the tooth and the organ system. And the emotion play an important role. So I'm picking up something, eventually go to the parasite cleansing, and I'm still picking up liver and gallbladder meridian, picking up, and I don't know, there's nothing physically wrong with it. So I do have an emotional chart. I will fold it and put it as a part of his socket, and then all of it balanced out. And I'll ask him, are we dealing with some emotional issue? It was a gallbladder meridian or liver meridian associated with anger, resentment. And then immediately patient will say, my mother-in-law is coming in and my wife never asked me that she's moving in. Withholding that anger and resentment. So sometimes you see so clear, but it's not always obvious,
When you evaluate a patient with the DNA Connections comprehensive oral test, looking at the DNA of 88 potentially harmful oral pathogens, don't we find that most people have many things in that type of testing, even if they're not chronically ill? Or are there specific infections that you consider more concerning when you see those in your patients? How often do you see parasites coming up in that dental DNA testing? I also noticed that they're reporting on some actinobacteria, which is kind of an evolving discussion in the Ritchie Shoemaker SIRS realm, or chronic inflammatory response syndrome, and wondering if maybe those dental pathogens also play a role in driving chronic inflammatory response syndrome. Talk to us a little about your clinical use of the dental DNA testing.
I did the first time about 8-9 years ago when DNA test came. I was aware of it. I have one patient with a squamous cell cancer of the hand in the thumb. And I went through the basic cleansing. He had a Crohn's disease. Parasite cleansing went away with the parasite cleansing. But he had this annoying pus draining in his right thumb, turning into squamous cell cancer. Every time I check, it's dental. Whenever I send to the dentist, there's nothing wrong with every known test, combi, CT scan, nothing. So he'll go to every known famous nutritionist and other practitioners, temporarily gets better, and still shows up again. What I see is a dental. And I just couldn't convince the dentist to pull the tooth that I was picking. I think it was like a number 11 or number 12. And I just found out about DNA tests. And meanwhile, the cancer is getting bigger, out of control. They want to amputate and radiation. And patient got scared. He decided to pull the tooth, and the dentist requesting patient sign the consent form not to sue him for consider substandard dental care for pulling the tooth as normal looking tooth. When I found out about that, I was not happy about it, and I requested DNA test to be done. The dentist with the DNA test shipped to the lab, the tooth. And then I have to treat them before there is the DNA test will come back. So I did put them on triple antibiotics. There's amoxicillin, metronidazole, and I believe doxycycline. I think it's a triple antibiotics. And within 3 weeks, his tumor shrunk down to almost back to normal. It was just a raw skin. And then I got the test back, and he's got multiple microorganisms, including entamoeba, denticolum, actinomyces. It's got all those strep, fusobacterium. Fusobacterium is associated with the lung cancer, colorectal cancer, the dental connection to the rest of our body. So there are huge territory of connection to the rest of the body is not a surprise. And so Fusobacterium is a big one associated with the cancer. And the Lyme, Bartonella, Babesia, associated hiding in the tooth. So you can look all over your body, but if you don't treat dental, the Lyme patient don't truly get one if they have a dental problem.
So when you're then using these antibiotics, antiparasitics, you mentioned metronidazole, for example, to address whatever may be in the oral cavity, that's kind of shorter term. So then do you recommend longer term that your patients are doing something like oil pulling or using specific types of rinses or other things to keep that oral microbiome as healthy as possible? We know now that mouthwashes are not necessarily good and can kind of carpet bomb our microbiome and impact our production of nitric oxide, for example. So what do you then recommend long term for these people that had significant oral bacteria or even parasites?
Right. Routine oil pulling is a good idea. I try to do every day if I can, but I do in the evening, not in the morning. Morning, I'm too busy. But sick patient, I do recommend twice a day oil pulling. I don't use antibiotic only in conjunction with dental operation or dental extraction. So I don't normally use antibiotics except coordinating with the dental work have to be done. So that's a short term, but you talk about microbiome. I just like to pointing out, I know importance of the microbiome and nitric oxide, but I think one of the biggest disruptor for microbiome, besides a faulty diet, is a parasite. From my point of view, to restore microbiome, we have to get rid of the parasite. Because we don't focus on parasite, that's the one actually disrupting, microbiome and create a leaky gut. And so that's kind of my emphasis on to restore the microbiome. Yes, go through the parasite cleansing, assuming it's indicated.
I've heard Dr. Klinghardt talk about how leaving an extracted tooth without an implant may not provide the mechanical stimulation for optimal brain health. However, we know that metal implants can be an antenna for electromagnetic fields. We know that titanium can trigger mast cells. So where do you stand today on the benefits versus the risks of a titanium or zirconia implant after a dental extraction?
I think zirconium is probably much safer than titanium. I always used to check for electrical current running through titanium. And the normal saliva have above 5 millibar of 0.1 milliamperes as part of the current with the saliva with the trace minerals. Titanium runs at over 200 millivolt. Sometimes go to 250 millivolt with a 25 milliampere. Those people within a month or sometimes within a year, sometimes have a weird neurologic symptoms, the high current running through, right going to your trigeminal lobe to the brain. So zirconium doesn't have that kind of a degree of a current running through our brain. So I think zirconium is, as a rule, safer than titanium.
So what happens then when a tooth is extracted in terms of the associated meridians and organs? So if people have their wisdom teeth removed, does that mean they're at greater risk for heart and gut issues later? What is the impact of that extraction on the meridian? Are the extractions essentially energetic dead zones or interference fields? Or might the meridian not be impacted where there is an extracted tooth that is left without an implant?
Okay, it depends on how it's well done. If the wisdom tooth came out for good reason and done correctly, you will not have any problem. I will not pick up through the meridian system. But if the wisdom tooth was extracted and have a residual infection because they didn't clean out the periligament, this is what Dr. Huggin talks about. 90% of the people is not done correctly and will become a problem. So it's not just a reason to remove, it's done correctly. Another example will be gallbladder. Gallbladder operation are the most common operation. If it's done for right reason and done correctly, I will not see any problem in gallbladder meridian. But if they remove for wrong reasons, I will still pick up through the gallbladder meridian as the problem. So it's not the operation itself, is that done for right reason and done correctly. The energy field is still there. Even if you remove the wisdom tooth or gallbladder meridian still exists. So people say, how could it be possible? I remove my gallbladder, there shouldn't be any meridian should be picked up. I said, no, the field is there. The field exists to create the gallbladder and our body. So meridian is part of the primitive ancient energy field. They're creating the physical multiplication of the embryogenic differentiation.
We are essentially 6 years into COVID. Many people dealing with long COVID. Some people talk about the persistence of SARS-CoV-2 in the body. Other people talk about long COVID as a spike protein toxicity. Still others talk about COVID as the great unmasker, where things that were contained by the immune system, like Epstein-Barr, Bartonella, Mycoplasma, parasites, maybe your tolerance to mold in your environment changes, and those issues now kind of come to the surface. You talk about many contributors to complex chronic illnesses like infections, chemicals, metals, nutrient deficiencies, the genetics, signaling between cells, metabolic function, mitochondrial function, the extracellular matrix, dental issues, EMFs, toxic emotion, so many things that you're looking at. I believe that in the book you mentioned that you associate COVID most commonly to the pericardium meridian. So what is the difference in terms of how you approach diagnosis and treatment in someone with long COVID? Do you see long COVID as having any unique characteristics, or is it more of the same?
I think there's COVID, especially with the vaccinated patient, have a tendency of a high spike protein antibody titers. I have several patients who have a ALS patient have a upper limit of a spike protein antibody titers. So history is important. If they get sick, I was doing well, but last several years I got this weird, unexplainable neurologic problem or cardiomyopathy. I'll check for spike antibody titers as a part of the evaluation and check for sometimes D-dimer. You'll be surprised many of them have a very high spike protein antibody titers, and they also may unmasking their other hidden problem and other hidden parasite or antiviral infections. So they create a new phenomenon. It's a new modern kind of an overlooked insult to our human body, but at least we have a spike protein antibody titer that's widely available, so we can check for it, and it's fairly inexpensive test.
So with spike proteins, we talk about spike protein binders. We know ivermectin is one that can be helpful. We know nattokinase is another. When someone comes back with an antibody for spike proteins that suggests to you that is a significant issue for them, how are you approaching the detoxification or denaturation or removal of those spike proteins from the body?
So I'm looking at spike protein. It's like a prion. It's almost like an infectious protein. And ivermectin has been very well known. I do use ivermectin. Dr. Peter McClure likes to use bromelain, curcumin, quercetin, and nattokinase. EDTA chelation therapy does oral and IV, works very well. Maybe UV ozone. I do have a EVO as a ozone filtration system. I don't have a apheresis. I cannot get it. But so I think there's more than one modality to treat your patient. But then there comes with the other hidden problem is showing up. There's like an Epstein Barr virus or maybe mimicking like a Lyme and whatever. Yeah.
You talk about Rantes or CCL5 being high in jawbone lesions or cavitations, and that then leading to immune dysregulation, even potentially tumor growth. Dr. Klinghardt talks about Rantes being at the core of retroviral activation in the jawbone and in the body. Dr. Bruce Patterson looks at Rantes in the context of COVID. What do you see as the trigger for or driver of high levels of Rantes? Is it the cavitation itself? Is it the infections in the cavitation? And do you or does your biological dentist or surgeon measure Rantes in patients before and after dental procedures to see if there is a reduction?
Most of the study done on Rantes was done by Dr. Leichner from Munich. He just retired, but he published many articles on Rantes. It's called CCL5. I think that's the proper name. I tried to get those things tested on my patient, but it's not available in the United States as of now. Not that I know of. I've been trying to looking for the test. In terms of the retroviral infection, not sure. I think they reactivate. If you know what's in cavitation, we know for the DNA test, there's a multiple microorganism, virus, bacteria, parasite. When I say parasite, usually I'm talking about entamoeba denticolon. So they create an inflammation that triggers probably another reactivation of the viral infection, and I will not be surprised it will be one of them of retrovirus and like post-COVID like symptoms. So yeah, it's huge overlooked areas that Dr. Leichner is bringing up. And for me, confirming through the DNA test. So it's not required, but I encourage my patient to request for a DNA test to be done. And also Lyme co-infections with that, because often they're hiding in the tooth, in the jawbone.
More and more people are using ivermectin long-term for COVID prophylaxis, as well as many other benefits, including autophagy and anti-inflammatory effects and immune modulation. I mean, it really is an incredible compound. We know now that ivermectin is over the counter in a handful of states, more to come. I know generally you don't use one anti-parasitic because then there may be some resistance that develops. But I'm wondering for those people that are using it for other potential health benefits, for COVID prophylaxis, for autophagy, those types of things, do you have any concerns or have you seen any significant side effects of ivermectin that persist long term?
I focus more on side benefit. I hardly ever see side effects. If you have some Alzheimer's reaction, I say that's a good sign, not a bad sign. I see people going blind, gaining their eyesight back. Some people, they say, apply for Social Security for blind, and their eyesight becoming almost back to normal. So I'm not concerned about side effect. If you have any strong reaction, I say, cheer up, it's a good sign. Continue to take it. And I never really use ivermectin alone. I sometimes, when you talk about like an anti-aging, sometimes I may combine them with the niclosamide. The studies showing Dr. Oz, I believe he's from Turkey. Those I read from, actually one of my patients gave me a book on, I think it's Tony Robbins interviewing Dr. Oz. And this is about WNT signaling pathway. Now, this is like they're betting money, billions of dollars to be betting on is a new wonder drug for anti-aging and regeneration drug. And I've been reading about the parasite medication. They always talk about parasite medication have effects on WNT signaling pathway. So I said, wait a minute. Maybe what I'm doing is not just parasite medication, but the effects on WNT signaling pathway. There's effects on regeneration, rejuvenation, and repair. It's like, oh my God. So the whole story about doubling the lifespan I heard from Iowa farmer is the secrecy is there in parasite medication. If you take ivermectin in a different combination, maybe niclosamide, it might be one of the best anti-aging medication, rejuvenation. Pharmaceutical company doesn't want you to know that because you can get those through the what I call farmers market with the tube with the ivermectin and parental palmoid and praziquantel and whatever. Yeah.
So I was actually going to ask you about Wnt signaling and the impact of antiparasitics in terms of anti-aging. So that was a perfect conversation. But I'm wondering, building on that, when we're thinking about anti-aging and optimizing lifespan and health span, is there also a role for working with senescent cells, zombie cells, for supporting autophagy, whether with supplements, or many people these days are using things like rapamycin and dasatinib to support autophagy to further support their anti-aging?
I have no experience with the rapamycin. Well, I think what you're referring to, I think spiral cell. Like some kind of anti-cancer therapy, but probably the most well-known, well-documented autophagy is maybe time-limited fasting has been most well-known, maybe in combination perhaps with a parasite medication. Rapamycin, not sure. There's, a potential side effect, but I don't know. I don't have enough experience to give you any information on that. And it's hard to do fasting.
When we talk about cancer, and I know we don't have a lot of time to go into this, but I wanted to touch briefly on the concept of the Warburg effect and how that affects cancer development and growth. What are some of the things that kind of shift the body into that cancer supporting metabolism where there's more acidity, more hypoxia, lower ATP production? Is it the infections? Is it toxicity? Is it inflammation? Is it all of those things? How do we shift the body back to a healthier metabolic state?
I think what's happening to this cancer cell is they're regressing back to their original state as a single cell protozoal metabolism. There can be in aerobic and anaerobic metabolism. They're metabolically flexible. They can go same time. You can have aerobic and anaerobic glycolysis. And to do that, you have to have all of the above, creating that the cancer cell thrive in the acidic environment. But if you look at the actual metabolism of cancer cell, they're not truly, there's a mitochondrial damage as we've been described. It's not. It's a mitochondrial function is adapt to the different environment. So when you look at the microscope of the mitochondria, of course, there's always a damaged mitochondria, but many cancer mitochondria thrives and they're highly functioning. But they're highly sensitive to actually what? Antibiotics and antiparasitic. And especially doxycycline, azithromycin, they target cancer stem cell mitochondria. The study was done in the University of Manchester. It was published about 2011. I think it's in my second book, actually describing all those antibiotic given right reason have an anti-tumor activity. That means infection is driving this metabolic dysfunction, but not damaged mitochondria as we've been told.
I know you don't specifically treat cancer, but you support patients that are dealing with cancer. Since COVID started, we've heard people talk about these turbo cancers. I'm wondering what you've seen clinically. In the last 6 years, are you seeing more cancer in your patients? Are the cancers more aggressive than they were prior to the pandemic? And do you think that the driver of these potentially more aggressive cancers is the infections, is the parasites, is the fungal organisms, the viruses, or even also our dentition? What's driving the increase in cancer if you're seeing that in your practice?
Yeah, I think it's all of the above. So with these post-pandemic, I think there is a more stress on immune system, and there's a reactivation of pre-existing infection that we could handle now becoming active. So there's a more infection, reactivation of the infection, more inflammation that create a metabolic disturbance and creating some young people. I lost very young people with a very aggressive cancer that I was surprised how they can be so aggressive. So yeah, I've seen it many, many times.
You say in the book that all living organisms possess complex electromagnetic fields. We may call that the biofield or biophotons. What happens to these organisms, including humans, when so much of the electromagnetic fields that we're bathed in today from the outside world are not health supportive? And how often do you find EMF-related issues impacting your patients, and how do they go about mitigating that?
Yeah, probably it's a lot more common than we may think, but how to mitigate is this whole topic. I'm not expert in that. Just to give you an example, I have one patient with all the chronic illness. I did what I know, dental parasite, and after over a year and have no improvement, so she left. If you don't help them, they're gone. And then came back a few years later telling me her story. I got well, I just want to let you know so that you can help other people. And she goes, I didn't know it, but they have a 5G tower outside of her apartment. She didn't know it. She didn't tell me anything about it. I did everything I can. I'd get rid of the heavy metal, but once she found that there's a 5G tower was put on there, they have to hire especially have a mitigate that the 5G radio frequency, electromagnetic field. That's when she got well. That's one story. I have one patient with a brain tumor, astrocytoma, had more than one brain operation, and go to the basic same thing, parasite cleansing, dental, heavy metal. I saw him using cell phone, and I said, you have a brain tumor, you should use cell phone. And that's I checked before, after all the cleansing, all the reading looks good, but I put cell phone on, and there's a dramatic change in his sensitivity to all the meridian system. You'll go to emergency room for heart palpitation. It will show in the heart, meridian, nervous system, all those. So it's individual basis. I don't want to be biased in a way, but I think being fat may help you insulate you to some degree from electromagnetic field sensitivity. So skinny people may be more sensitive to EMF than, let's say, somebody who have a muscular and more weight on. That's sort of my observation. Yeah.
With chronic Lyme disease, this is an area where I think we have slightly different perspectives, but maybe not so much. You've talked about addressing parasites, fungi, dental issues, often improving the health of someone who has chronic Lyme. At the same time, I've seen people where Bartonella and Babesia were significant and they did benefit from treatment. You find some of these Lyme-related infections, as you mentioned, in the mouth, in the dentition, in the cavitations with that dental DNA testing. So is it possible that with the antibiotics and antiparasitics that you're using, that those are also having an impact on the person's systemic vector-borne infections, and that you may be treating their Lyme disease at the same time, even though that may not be your focus?
It might be true. I think we have to focus on terrain. We have to improve the overall conditions. So I see people with positive Lyme have no symptoms at all, and there's a Lyme negative, and there's a zero negative Lyme, but you really don't know. We have to treat the whole terrain. This is why, rather than focusing on Lyme or Bartonella, Babesia, you have to look at the whole body. Now, when you're talking about this oral cavity, like a DNA test, they measure 88 common microbes. Average oral cavity have a 300 to 500 different microorganisms, but far more through the gut. So we have to treat the whole terrain. Icemen have a Lyme disease. The Iceman in Alps has got Lyme disease and parasite. I have a patient with husband and wife coming from Germany, live in Midwest, but coming from Lyme clinic in Germany, specializing in Lyme, using all those IV laser therapy, hyperbaric oxygen, all those. Moderate success. When I get the history, husband positive for Lyme, classic IgM, IgG, and Agenix test. Wife totally negative, but treating as a classical Lyme, all the symptoms with the Lyme. The difference, the patients or the wife have a 6 root canals. The other fellow with the Lyme don't have any root canal at all. Even if the terrain is different. So that creates a symptomatic. You can have a Lyme, but you have to treat the whole body, then it's not a problem. Problem may go away. So we're saying basically the same thing.
I agree. Yeah. The terrain is definitely key in addressing Lyme and all of these other things that we're talking about. So many people these days are dealing with neurodegenerative conditions. We think of MS, Parkinson's, Alzheimer's, unfortunately, seems to be increasing since the pandemic. Some people also dealing with ALS. Wondering if those are generally showing up in your system under the nerve degeneration meridian. Is there an aspect of these infections driving neuroinflammation, which then is further contributing to neurodegeneration? And in those complex neurodegenerative conditions, are the themes the same? Is it primarily parasites and dental, or are there unique patterns that you observe?
It will show through the nervous system in meridian system, but not just that alone. Always in combination with a large intestinal meridian, gallbladder meridian, and dental meridian. Almost always it will show. And what's driving neuroinflammation is the 2 dominant meridian system I'm aware of is the dental, picking up to the lymphatic system in your thumb. That go right into your trigeminal nerve by the palms in the brainstem. They can go down to your have a nucleus of the cervical nucleus of the trigeminal nerve, go down to your C5, weakness of the hand, will go to the brain, through the thalamus going into your cortex that create other neurologic problem. And I'll pick up through the vagus nerve, through gallbladder meridian and stomach meridian, go right into your brain cell, right next to dental. They're the 2 dominant meridian system affect in the brain. And then all the central nervous system is right there in the brain cell. So any sensory, motor, all those things right there. If you're taking care of those early, prevent it, you can maybe reverse it. But it's end stage, somebody is in a wheelchair, it's a totally different game.
You talk about a case of Ehlers-Danlos syndrome in the book. It seems to me like this has really exponentially increased in the past 6 to 8 years. I tend to think that there's 2 groups, the more primary genetic EDS, but then also the secondary EDS, where there's some trigger that then leads them into that connective tissue disorder, maybe Bartonella, maybe mold, maybe parasites. We know that elastase can break down our structural integrity. We know elastase can be created by mast cells. You say in the book, which was another good new thing for me to think about, that parasites also create elastase. We also know that parasites can trigger mast cells. So there's a couple of things happening there where maybe there's more of this elastase that's negatively impacting our structural integrity. Wondering what you've seen in treating people with Ehlers-Danlos syndrome in terms of the imbalances and restoration of their health. Does the work that you're doing reduce or resolve or improve their EDS presentation?
Most people doesn't come to see me for Ehlers-Danlos syndrome, but they may have a chronic fatigue, fibromyalgia, MS, whatever problem. And then, as I was told, I have a Ehlers-Danlos syndrome. So if you correct the other underlying problem, sometimes this Ehlers-Danlos syndrome become a secondary issue, become not a major problem. Their joint is more stronger, doesn't have the subluxation. So I think we are focusing on wrong focus. And then we are so focused on analyzing the subtype. There's 13, 14 subtype of Ehlers-Danlos syndrome, including genetic, tests. But what the article I was referring to is that the microorganism can also hijack the DNA genetic expression. So it may not be genetic, it might be the microbe and infection affecting the genetic expression, and we call that genetic associated, Ehlers-Danlos syndrome. We have to correct the underlying problem. I always tell my patient, I don't dwell on your diagnosis. I'll write it down. But if you correct a major underlying problem, they become not relevant to them anymore.
So let's for a moment dwell on another diagnosis, which is Morgellons. This is a condition where people really are oftentimes tortured by these filaments that come out of their skin. We know that about 6% of people with Lyme disease develop Morgellons. We know that about 95 or more percent of people with Morgellons also have Lyme disease. I suspect there's some correlation to Bartonella, but more research to be done. Wondering what you've observed in your patients with Morgellons. Are they also improving with a focus on parasites and dental issues?
Think of it like a Lyme. You say 6% of the people have Morgellons. How many people with Lyme also have a parasite problem? How many people with Lyme patients have a dental problem that was not recognized? How many people with Lyme patients have other protozoal, fungal infection, whatever? So it's a co-infections. And again, I try not to focus on the Morgellons per se, what's the underlying problem. And I would say not many, because people don't come to see me for Morgellons, but whatever other underlying problem. And you'll be surprised when you treat aggressively with the parasite medication. At least I can say my Morgellons like symptom may go away, or 90% improvement. I hear that many times. So I don't do on that diagnosis. Yeah.
You mentioned earlier the potential benefit of some antiparasitics on eyesight. One of our listeners was interested in your thoughts on macular degeneration. Is macular degeneration something that also can improve with the approach that you're using?
Okay, so it will be like for me retroactively. I have a physician came for concern for parasite problem, and he happened to have a macular degeneration. He was telling the story over here. When I was treating for parasite problem, his macular degeneration went away. So prevent him from going blind. I see many times this eyesight improve, but then you have to look at which meridian control eye or eyesight. So gallbladder, liver meridian, stomach meridian, bladder meridian, all those in play and control happen to be improved often with a parasite medication. So it's all interconnected.
I want to talk a little bit about detoxification since we talked about the impact of the terrain on our health. We talked about how detoxification potentially also is an indirect antimicrobial strategy if we create a terrain that no longer needs these parasites and fungal organisms to potentially protect us from heavy metals, for example. Wondering what some of the tools are that you're using for detoxification, particularly around heavy metals. What's emerged for you in that realm? Have you been exploring some of the emerging tools, which I don't think are really available yet in the US, but there's amaramide from Boyd Haley's work. There's another compound coming called HOPO or HOPO. Wondering what your thoughts are on dealing with heavy metal toxicity and optimizing our toxic terrain.
Right. Dr. Boyd Haley developed a medication is called OOSI, and was withdrawn by FDA for unfair reasons, and then came up with a different name, but same medication. Now, I believe available in Costa Rica and Ireland. Are there any better than DMPS? I don't know. I'm not sure. I tested it out, but I didn't find any superior to DMPS, but there's many different chelating agents out there. The one I use, DMPS, EDTA, DMSA. Seldom I use sometimes penicillamine. And the natural remedies and the support, kidney support, liver support, glutathione, N-acetylcysteine, lipoic acid. Yeah, always kidney support, toxacs, help you to excrete the toxins. So that's as part of the standard. I always measure if there's any suspicion for environmental toxin, usually through the allergy immunology point, and then I will do the provocation test. And if it is a mercury, I do use DMPS and DMSA. If it is a lead, I will use EDTA. It's not a good idea to use EDTA for mercury toxicity. It may create a potentially even bigger problem down the road.
I think that's a good clarification for listeners. You mentioned earlier that you may use homeopathy in children, but one area where you do use homeopathy is in supporting drainage, supporting liver, kidney, lymph, and matrix as part of your protocols. A lot of those tools that you're using that are drainage remedies are more complex homeopathic tools, and they're very, very powerful. You also use liver gallbladder flushes. I've done dozens of them over the years, but I've always been a little hesitant to encourage other people to do them. I think they're a little more aggressive. Maybe not everyone tolerates them. So I'm wondering, are those a key part of your treatment because they're helping to move out some of the parasites that may be sequestered in the gallbladder? And how do your patients normally respond? Do you hear of significant complications or people not tolerating doing liver gallbladder flushes, or does it usually go pretty smoothly?
Most people have no problem if they follow the instruction. 1 out of 1,000 people may go to emergency room with intense abdominal discomfort or nausea and vomiting. One of the reasons they have a problem is that you have to be empty stomach when they drink the olive oil, but they still have food in their butt. They didn't realize and that they vomit, have some intense cramps and spasms. But those are very rare. 2 out of 3 people, 70% of people will pass some sort of a stone. It could be a lentil size to actually I have one patient describe size of the golf ball and canceling the gallbladder operation. So one of my favorite stories to tell my patient is, especially cancer patients, I make them to do 6 gallbladder liver flush as a minimum. I have a breast cancer patient, 75-year-old, 6 gallbladder liver flush every month. Patient called me after 5 months later. I cannot stand doing gallbladder liver flush. I tried 5 times, nothing coming out. I'm not doing it anymore. Have to remind her, I said 6 times, you got 1 more to go. Now, please do 1 more, but this time you prepare for 7 days, not typical 4-day preparation, not half cup of oil, drink the whole 1 cup of oil. Man, she was complaining she don't want to do it. I have to talk her into that. Just 1 more, then I'll leave you alone. If you don't pass anything, don't do it. She called me 7 days later, and she said, you don't believe this. I passed over 250 stones, complete filling, the green board, complete filling the toilet. I don't know how she counted 250. The best story it doesn't end. So she never came back to see me after she felt so much better. One of the first things people notice is that their mind is more clear. All the clogs stop coming out. They feel more clear thinking. And I haven't seen her. She never came back, but her daughter come to see me. And how's your mom doing? It was, she's doing very well. She belonged to the Breeze Club. And now all the Breeze Club members do gallbladder liver flush as part of their cleansing. So she was so convinced that helped them so much, she didn't want to do it. Then now everybody's doing gallbladder liver flush for those Breeze Club members. Yeah.
I mean, I've probably personally done 40 of them over the years, including just this past weekend, since it was time to get rid of the old for the new year coming in. And they still very much are very beneficial. And you still do observe, or I do observe, not with every single one, but oftentimes you do still see some of those stones. So I think it's a helpful tool. I just encourage people to maybe be kind of talking with their practitioner to make sure sure, like you said, that they're doing it right. Other tools in the detoxification realm, given that our terrains are becoming more and more toxic, are things like apheresis, which you mentioned, EBU, which filters some, but also has a wonderful effect for some of the microbial components that people are dealing with. I think you're probably familiar with ionospheresis from Germany and Europe, Dr. Richard Straube's work, not yet approved by the FDA, but my understanding is there are some clinics that are bringing that in this year or next, which will be a great addition to our arsenal. We also have therapeutic plasma exchange as another powerful tool that you see many people talking about these days. I'm personally hesitant about TPE because I'm not comfortable taking something that is a human blood product unless I really needed it. But I'm wondering what of these more advanced tools that we have available or that are coming on the horizon do you think will have a key place in dealing with our toxic terrain?
Oh yeah, I think so. I think he's got adjunct therapy. I don't have a apheresis or plasmapheresis, but I do have a EBU. Sometimes their filter system will pick up minor micro blood clot of some sort. So you can see that, and people swear by, some of patients say, swear by it does help them. People do congestive heart failure and all kinds of chronic infection. It will see through the micro clot. You'll see through the filter system. Yeah. So it will be adjunct therapy, but it will not replace for parasite cleansing or dental infection have to be taken care of.
So many people these days are dealing with, quote, autoimmune conditions. Do you find that autoimmunity is generally triggered by the infections, maybe by the environmental toxicants in our body? Have you observed that the treatment approaches that you're doing with the chronic infections and the detoxification bring resolution to someone's autoimmune label or diagnosis? Is autoimmunity a real condition, or is it a label that represents a symptom of chronic infections and a toxic terrain?
I think you said it all. I don't have to say it anymore. Yeah, I'm really. It's just individuals have a different oral immunity based on different combination. So you have to individualize. You exactly said the general concept of it. Now, as a clinician, one is Hashimoto, one might be lupus, one might be, whatever other, there's a new autoimmune disease because they never correct the underlying problem. So yeah, you have to do it, but have to be, individual basis. This is where the Acupuncture Meridian Assessment does help. Not just so AI give you all the description of the particular, autoimmune disease.
Many people today seem to be reaching for biologic medications for things like eczema or psoriasis or autoimmune conditions. How often does addressing the parasites and the fungal issues, maybe their dentition, bring resolution to those types of conditions? And could it be that biologics are suppressing the exact parts of the immune system that they need to respond to their chronic infections, maybe making us feel better, but actually leaving us less healthy?
Right. If you listen to in TV commercial with all the side effects, they'll give you a clue. It's suppressing your immune system. I have a patient just today. She comes every year. Whenever she has a skin breaking out, she knows there's a parasite problem. So she'll come, I go through the parasite cleansing, goes away, and then a couple of years later, have another eczema or some sort coming out. She come back, I go to check, parasite cleansing goes away. So I see the pattern is there. But everybody's a little bit different. Another person might be different combination. That's why I don't have any protocol. Yeah.
Some people will suggest that mitochondrial dysfunction is a significant component of chronic illnesses. It could be that we are positively impacting mitochondrial function by removing infections, removing toxins that were negatively impacting our ability to produce ATP in the first place. But I'm wondering if you also find value in supporting a patient's mitochondria with red light therapy or methylene blue, for example, while you're also working on those underlying factors?
Yeah, people who can afford to have a red light at home. We do have a red light bed and encourage to take methylene blue with that at the same time to maximizing it. Yeah, so those are sort of a basic tool. You can do what we call biohacking at home, not necessarily the medical clinic. Yeah.
It seems that having an optimal microbiome these days is a nearly impossible task. Some suggest that 95% or more of people tested today show no measurable bifidobacteria. What tools are emerging for you as interventions that are moving the needle in optimizing the microbiome? So we talked about parasite treatment can optimize the microbiome, but then is there a restoration phase where you're then bringing other things in, whether it's probiotics, prebiotics, postbiotics? How do you optimize the microbiome after you've addressed those chronic infections?
I don't have any specific therapy, but I do encourage diet should be the foundation to restore the microbiome. Just don't expect it will be done immediately. It's a whole process where either fermented dairy products of some sort, or like a fermented vegetable and meat and whatever, all have microbiome that you have to reintroducing it. We're going to lose our native microbiome through the mother to the child. But yeah, I think we can restore it. I'm not that pessimistic as some of the people describing a carpet bombing with the one cycle of antibiotics. No, our microbiome is incredibly resilient. So, there are so many thousands of different microbiome. Don't fixate on the one dominant microbiome. Life is too short to have a micromanage every single thing. So when I used to address with dental infections, I will use different combinations, including doctor's biome, especially when I use clindamycin because I'm afraid of the C. difficile. So I will add doctor's biome to make sure we cover for potential risk for C. difficile. Yeah.
We're down to our last two questions before our final wrap-up question. Where do oxidative therapies fit in your toolbox? Do some patients still benefit from ozone or hyperbaric oxygen therapy? Have you started working at all with ozonated glycerin? What are some of the oxidative therapy tools that you regularly use in your practice?
Ozone therapy is the most common one I use. I do not use hyperbaric oxygen. I used to keep breaking down, and at this I'm not going to use it. Too labor intensive, and I don't have experience with glycinate ozone. That I don't have experience, but I like to use actually UV light therapy in conjunction with ozonate blood that combination works very well. But I don't do 10 pass. I don't do 10 pass ozone. It can be a little bit hard on your body.
The paired gallbladder and dental meridian can reflect what's happening in the brain. You recently have talked about Dr. Petros Katou and his work at the Sozo Brain Clinic in Cyprus, where they're using things like TDCS or transcranial direct current stimulation and TAVNS, transcutaneous auricular vagus nerve stimulation. I know that you spent some time there and that he's also taught at some of your AMA trainings. I believe Dr. Klinghardt has also spent time at that clinic in Cyprus. So what have you observed with the tools that are emerging from that Sozo clinic? What have you seen around people with Parkinson's disease? What are some of the benefits? And are those now tools that you're able to implement in your practice in St. Louis?
Yeah, part of it. Now, Petros Katou will revolutionize the neurology whole entire field, combining transcranial direct current stimulation, vagus stimulation, and one that's not available is called transcranial pulse stimulation using ultrasonic stimulation. It's not available. Now, Harvard University is working on it for Parkinson's patients. This device has been available in Europe, and that it will revolutionize the whole neurology as being playing the rather than passive role. Now can be actively involved in actually care of the patient. So I did give actually very recently in Vienna on brain neuromodulation conference. If the patient comes early stage, diagnosed with MS, I've seen many people respond to underlying problem like a parasite, fungal, dental, etc. But if it's not corrected, 15 years later, 20 years later, the patient might be in a wheelchair. When the patient is in a wheelchair, parasite cleansing dental is not good enough. It's not going to make them to stand up and able to walk. I think you still have to go to the parasite cleansing dental work, but then people already in wheelchair need some stimulation to the brain itself to be able to stand up, and has been documented many times in Europe by Petros Katfu and people who have access to using some of their device. So I think it will change the whole game, but it's a matter of time to get this device.
My last question is the same for every guest, and that is, what are some of the key things that you do on a daily basis in support of your own health?
Exercise, stretching exercise, yoga exercise. I do coffee enema as part of my routine.
Me too.
I do have a mercury and palladium toxicity at a extremely high levels. I'm very cautious about that. I did have a vaccination, COVID vaccination, to travel to internationally. I have a high antibody titers, so Ivermectin is part of my program. So these are things I do proactively, and exercise, important part of my program.
Dr. Yu, this has been another amazing conversation. I respect you so much and the work that you do. You are brave in entering into territories that could be difficult for some to talk about. You are a bright light in a world that needs more light. Your work is profound. I hold you in the absolute highest regard, both in terms of my experience working with you as a patient, but also mentoring with you, learning from your books, learning from your work. You are a tremendous gift to the world, and it's my great honor to have you on the show today. So thank you so much.
Well, thank you for the invitation. I enjoyed really talking to you.
To learn more about today's guest, visit preventionandhealing.com. That's preventionandhealing.com. preventionandhealing.com. Thanks so much for listening to today's episode. If you're enjoying the podcast, please leave a positive rating or review, as doing so will help the show reach a broader audience. To support the show, visit betterhealthguy.com/donate. To get my newsletter, visit betterhealthguy.com/newsletters. To follow me on Facebook, Instagram, X, or TikTok, you can find me there as Better Health Guy. This and other episodes can be found on Apple Podcasts, Spotify, Amazon Music, YouTube, and Odyssey.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.